Did you know that your body is a loyal friend? It never betrays you. Instead, it whispers to you through small signs before things become too late. Welcome back to Senior Life, Joy and Wellness. Today, we're reopening up a vital topic: the 7 signs the body whispers before it screams, with a stroke, heart attack, or a dementia diagnosis. If you are over 50, the next few minutes could completely change the quality and longevity of your life. This is the story of Mr. David, a retired university professor in California. Mr. David was an intelligent man, but he made the most common mistake. He dismissed his symptoms as just old age. "Oh, I'm tired because I'm getting old." Or, "A little dizziness is normal." This complacency almost cost him his life. We will use Mr. David's journey to analyze the 7 whispers he initially ignored. Whisper number 1, chronic fatigue. The sign: feeling utterly exhausted even after adequate sleep. The fatigue doesn't subside with rest and lasts for weeks or months. Mr. David frequently felt drained in the afternoon. He thought it was due to age and tried to drink more coffee, but he was ignoring the first whisper. The underlying risk. Chronic fatigue is not a sign of normal aging. It's often a signal of an underlying illness brewing silently. This could be early congestive heart failure, CHF. The heart is working too hard to pump blood, leading to oxygen debt. Underactive thyroid function. The thyroid produces too few hormones, slowing metabolism. Chronic inflammation. The body is constantly in a state of battle, draining energy resources. Immediate action. If your fatigue is not caused by physical exertion, have your thyroid and cardiovascular function checked immediately. Do not accept exhaustion as a normal consequence of growing older. Whisper number 2. Sudden swelling in feet and ankles, edema. The sign: noticeable swelling in your legs, feet, or ankles, especially if you press the swollen skin and the indentation remains for a few seconds. Mr. David noticed his feet often swelled by the end of the day, particularly after sitting for long periods. He bought compression socks and thought that was sufficient. Heart failure. The heart does not have enough force to pump fluid effectively, leading to fluid pooling in the lower extremities. Kidney disease. The kidneys are failing to filter fluids and salt efficiently. Deep vein thrombosis, DVT. A blood clot is blocking the blood return, particularly dangerous if the swelling is only on one side. According to the American Heart Association, unexplained swelling is one of the primary signs of congestive heart failure in older adults. If it appears suddenly, you must seek medical attention immediately. Whisper number 3, cognitive fog and difficulty finding words. The sign: frequently forgetting familiar names of objects, struggling to concentrate while reading or watching TV, and a general feeling of mental cloudiness. Mr. David, a former professor, noticed he often had to pause for several seconds to recall simple vocabulary. He would laugh it off, saying, "Just senior memory." The underlying risk: this is not normal aging. This could be the start of mild cognitive impairment, MCI, or early-stage Alzheimer's. Toxic proteins are beginning to accumulate in the brain. Transient ischemic attack, TIA, mini-stroke. Small blood clots temporarily interrupt blood flow to the brain. Neuroaging research emphasizes that issues with language recall are far more significant early warning signs than merely forgetting where you put your keys. Whisper number 4, unexplained shoulder, jaw, or upper back pain. The sign: persistent pain in the left shoulder, arm, jaw, or upper back that is not related to a noticeable injury. Mr. David occasionally felt sharp pain in his shoulder and assumed it was just a muscle strain from sleeping incorrectly. He took a pain reliever and ignored it. The underlying risk in older adults: heart attacks often do not manifest with classic chest pain. They are frequently silent heart attacks or atypical, presenting as radiating pain to the shoulder, neck, jaw, or upper back. This is particularly common in women and patients with diabetes. If the pain appears during exertion or is accompanied by shortness of breath, it is an immediate emergency signal. Whisper number 5, unexplained dizziness and unsteadiness. The sign: feeling disoriented, lightheaded when standing up, or feeling like the room is spinning. Mr. David often felt a dizzy spell when moving from a sitting to a standing position. He attributed it to his blood pressure. The underlying risk: dizziness is a warning sign of the highest risk of falling, which is the leading cause of injury and loss of independence in older adults. The causes can include orthostatic hypotension, a sudden drop in blood pressure upon standing, a common side effect of BP medication, inner ear issues, vestibular disorders causing loss of balance, cerebral ischemia, interruption of blood flow to the brain. Immediate action: never ignore dizziness. Always move slowly and consult your doctor to adjust your medication if needed. Whisper number 6. Sudden changes in vision or blurred sight. The sign. Vision narrowing. Suddenly seeing flashing lights or partial vision loss like a curtain drawn across the eye. The underlying risk. This could be a sign of transient ischemic attack, TIA mini-stroke. A blood clot reduces blood flow to the visual area of the brain. A TIA is a clear warning that a major stroke could occur within hours or days. Uncontrolled diabetes, retinal damage. Do not wait. If vision changes suddenly, it is a neurological emergency. Whisper number 7. Loss of sense of smell not caused by a cold. The sign. Loss of the ability to smell familiar things like coffee, food, or dangerous odors like smoke. The underlying risk, loss of smell unrelated to a respiratory infection, is a strong and very early indicator of Parkinson's disease, often preceding motor symptoms by many years. Cognitive decline. Loss of smell is linked to the decreased function of the brain regions that process both scent and memory. If you notice you can no longer smell your favorite food, treat it as a warning from your nervous system. The truth is, Mr. David ignored all these whispers. He only went to the hospital when his body screamed with a silent heart attack. Luckily, he survived and became the person who tells this story. Expert advice. Your body doesn't create superfluous symptoms. Listen to the whispers as if they are life and death commands. Early intervention can help you reverse conditions and protect your golden years. And now, which action will change your life? Which of the 7 costly whispers have you ignored the longest? Share below. If you found peace in this message, please hit like to spread the message. And subscribe to the channel so we can continue this journey together.